I conducted my peak project with an 8-year-old male receiving ABA services through the company I work with. He was referred for services in order to develop social and attentive skills to increase the time he spends in his traditional classroom versus being pulled out to the special ed room. I asked his mom and the other behavior therapist and BCBA on the case to complete the peak assessment survey. Once the survey was completed, the results were compared with his current treatment goals, which had actually just been updated and new goals added. 3 programs were selected that were not marked on the peak survey and were also current treatment goals. These programs were follow 3-step directions, tact time, and silent reading. The programs were presented in the same order as they're listed there, and multiple baseline across skills design was used. The programs were presented using discrete trial method as described in the peak book, and sessions occurred in the client's home, in his bedroom, during his regular ABA session time. Baseline data was collected for each program. In order to keep the response scoring system the same, I modified it for baseline and assigned a score of 0 for no response, 2 for incorrect response, and 10 for correct response. All intervention data were collected in trial blocks consisting of 5 trials. Response scores were added and then multiplied by 2 in order to get a score out of 100. For 3-step directions, the client was given a series of 3 instructions, and he had to wait until all instructions were given before responding. A correct response meant that he completed all instructions accurately and in the order they were given. This child works for points for each activity, so a correct response meant that he was given verbal praise, and it was also reflected in his point score. An incorrect response or no response meant that attention was removed and the SD was represented with a prompt that would help him get the correct answer, the least restrictive prompt that would help him get the correct answer. Data were collected using the peak response scoring rubric. Tact time, the client was presented with a picture of an analog clock and asked, "What time is it?" A correct response meant that he gave the time that was shown on the clock, and he was again given verbal praise, and it was reflected in his points total. Incorrect response or no response, attention removed, SD represented with the least restrictive prompt. Silent reading, the client was presented with a sentence and asked to read it to himself, and then the therapist asked him 1 or 2 questions about what happened in that sentence. Correct response, he answered the therapist's question correctly. Given verbal praise, reflected in his score for the activity. Incorrect response, attention removed, SD represented with the least restrictive prompt to help him get the correct answer. This is a graph showing the results of the programs. And you can see that for each program, his response score increased from baseline. This is for following 3-step directions, tacting time, and silent reading. For 3-step directions, baseline stabilized between 52 and 36, and then during intervention, his scores increased to 100, and then stabilized between 92 and 100. For tacting time, baseline stabilized between 36 and 48. During intervention, his scores increased to 100 and leveled off at about between 96 and 100. For silent reading, baseline stabilized between 52 and 68, and during intervention, the scores steadily increased to 100. Again, the response scores showed an increase in independent, correct responses for all programs. The client acquired skills quickly. This was demonstrated by the fact that he only required multiple prompts for the first couple trial blocks. After that, he was quite consistent in only requiring 1 prompt when he didn't respond independently. Prompts were usually verbal or gestural, and mainly to remind the client to attend to the presented stimulus. For following directions, he needed prompts to wait to hear all of the instructions, or a prompt to verbally state what the instructions were so that he could complete them all. For tacting time, he was prompted to pay attention to the numbers that the hands on the clock were pointing to. Sometimes he was just briefly glancing and then not really focusing on what was in front of him. And other times he would just guess. So he was prompted to count. If the small hand was pointing to a tick mark on the clock rather than a number, he would just guess the large number close by it. So he would be prompted to count from that number so that he could give an accurate response. For silent reading, he mostly needed prompts to wait to hear the entire question before responding, and also needed some prompts occasionally referring back to the sentence. What was the subject of the sentence? What was the verb? Those types of things. It's recommended that each program should be continued until he achieves mastery for each program. This client would also benefit from programs that focus on listening skills and on-task behavior as well. For him, listening skills would mean recalling information that was presented to him orally, and also showing comprehension of information presented orally, and increasing his eye contact when he's being given an instruction or engaging in a conversation. On-task behavior, programs that would require him to ignore other stimuli in the room, things that are on his desk, other people, other sounds, completing tasks in a specific amount of time, and sitting upright and facing forward. He has a tendency to slouch in his chair or orient his body away from the speaker or the work that he is doing. Overall, the PEAK program showed improvement in his skills in these 3 programs, and I think he would benefit from continuing to work on them. Thank you.